This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Welcome to Funny Medicine.
Welcome to Funny Medicine. I'm Evie.
I'm Julie.
I don't know why I did that. Welcome to our show. Anyways, today we're talking about testosterone.
It's use
and
and
its
abuse.
Yes.
Yes. Because, I figure we're in the summer. Some people are trying to bulk up, do stuff like that. And then they venture down a hole that might be not too great if you're abusing it. So let's give you guys some information on that.
Yes. All right.
Go.
So what is testosterone? Testosterone is a steroid hormone born from cholesterol, a familiar character in the story of heart disease. But instead of clogging arteries, testosterone takes that backbone of the rings and reshapes it into a potent chemical messenger, okay? A hormone. So it's produced predominantly in the testes for men and in smaller amounts by women ovaries. Yes, women also produce testosterone. And everyone's adrenal glands. So it circulates through the bloodstream into two forms. Most of it bound by proteins like sex hormone binding globulin. Cool. Another hormone.
Yeah,
okay.
Just a hormone.
And then a small fraction is freely roaming to exert its effects. That's why when a doctor measures it, they're going to get a total and free testosterone. Okay. This balance is going to shift subtly throughout the day, peaking in the mornings to help explain that groggy but motivated feeling that many men report on waking. And then...
I had to. Hey, he kept on saying morning, and I'm like,
girl. Anyways, Jules. Okay. And the thing is that I saw that in the corner of my eye. I don't know what my face is gonna look like when you.
I'm dying to edit this
go back
one.
to that clip.
This is gonna be freaking great.
Anyways, so underneath it all lies a. I'm gonna just drink. Oh, God, I hate endocrinology. I'm just looking at all these hormone names.
I know.
All right, so underneath it all...
So I'm trying to make it funny because, goddamn,
this is a heavy topic. So underneath it all lies a tightly regulated feedback loop. So the hypothalamus issues a command, okay? Then the pituitary relays the order in the form of LH, luteinizing hormone. And then the testes respond by cranking out more testosterone, okay? When the levels are ample, the brain senses the surplus and dials production back. So it prevents the runaway hormone storms, okay? So unlike many molecules that flicker in and out of cells almost instantly, testosterone's steroid structure allows it to slip through the cell membranes, bind to the intracellular receptors, so those receptors that are inside the cells, and then tweak gene expression over hours to days. The result is a wide-reaching influence on everything from muscle growth to bone density to mood, libido. Far from a man hormone, it's essential for people in all genders.
Yes.
Okay, so even women.
Yes.
Women need it to sustain bone health, maintain energy, and really support sexual desire. Okay. In its sweet spot, testosterone, T, okay,
Yeah.
keeps bodies robust and spirits engaged. Now, outside that zone, whether it's too low or too high, life can feel decidedly a little bit off kilter.
Yeah. So that's why you got to monitor that level all the time. Okay. So the science behind its natural production, right? So before we go into it's injecting, how you inject it and whatever, how do you supplement it? Let's go to how it's naturally produced. Imagine an assembly line where cholesterol arrives at the cell and a series of enzymes, so these tiny little machines, they sculpt it step by step and they make it and they turn it into testosterone. So the process begins in specialized cells known as Leydig cells. And that's inside the testes. So under the watchful gaze of that other hormone that we had mentioned, the LH hormone, these cells activate a cascade of conversions through enzymes, which I'm not even going to bother telling you the
Yeah,
main
so
book.
like messengers tell something to another messenger,
Yeah.
to another. It's just like a cascade of events.
It keeps on going, like a domino effect, kind
Yes.
of, and others. And then they're like honing the molecule's shape until it emerges as testosterone. That's how it's made. So meanwhile, smaller production line in the ovaries, so for females, employs the same toolkit, although in a much gentler pace. So delivering the hormone women require for their own physiological equilibrium. So the brain keeps production honest via the hypothalamic
Hypothalamic.
that pituitary gonadal axis.
Yeah.
HPG. All right. So
That
it's
just
your
means
brain.
It's brain, pituitary. Well, I shouldn't say brain because pituitary gland is also in the brain, but hypothalamic, pituitary gonadal. It's just like a messenger system.
Exactly.
So your boss, your CEO tells your boss something and it tells you something.
Exactly.
Yeah.
That's pretty much it. So when testosterone dips below a certain threshold, neurons in the hypothalamus release gonadotropin releasing hormone. And this is promoting the pituitary, so that other part in your brain that like sends out these hormones to secrete LH. All of this, that's just pretty much the cascade. So your brain keeps it in check, lets you know if there's too much, too little, pituitary will go ahead and act accordingly. If there's too little, it'll produce more. If it's a lot, it'll produce less.
Yeah.
And whatnot.
The way I explain it, it's like a feedback.
Exactly.
Okay. So if your body doesn't detect that there's enough, it sends a message to your brain, hey, we need more. If your body detects it's too much, it tells your brain, hey, we need less. That's just the feedback. And it regulates. Your body is always in like in an equilibrium. That's one of the first things that they teach us in physiology. And I think homeostasis. And I think before we're like, well, okay, whatever, homeostasis. But
Right.
if you really think about it, I'm happy that they told us about homeostasis because it all makes sense because at the end of the day, we're always in a balance. And that's usually how things work in the body. All right, moving on. Legit medical uses. When doctors actually prescribe T. I'm just going to say T instead of testosterone.
Yeah.
Okay? In clinical medicine, T is used as targeted therapy for well-defined conditions. Okay, so there's definitely a place for prescription of T. Okay.
Yeah.
Chief among them is hypogonadism. So what is that? It's a state where the testes fail to manufacture sufficient testosterone. Now, causes range from genetic anomalies like Klinefelter syndrome, genetic syndrome, testicular injury, or also to the pituitary disorders and age-related decline. So men with hypogonadism often present with fatigue, sleep, and that coffee can't fix it, loss of libido, erectile dysfunction, anemia, decreased muscle mass, and also bone thinning. It's a constellation of symptoms that erode quality of life. And for these patients, testosterone replacement therapy, or TRT, isn't a luxury. It's a return ticket to normalcy, like feeling how you used to feel before.
Getting that energy back,
Yes.
all that stuff. Yeah,
Now,
it's important.
Yeah, exactly. Now, hormone delivery arrives in many avatars. So intramuscular injections of T offer bi-monthly schedules with predictable peaks and valleys. Transdermal gels and patches provide daily, steadier absorption, but demand diligence in application and caution to avoid transferring T to loved ones.
Right, because if it's like you could touch it
Exactly.
transfer it to somebody
And that's actually more common than what people think.
I know.
Subdermal pellets implanted under local anesthesia every 3 to 6 months let you kind of like set it and forget it, though they require minor surgery to maintain, very minor surgery. All right. More recently, oral testosterone capsules like Jitanso have entered the arena thanks to lymphatic absorption that sidesteps liver destruction. So for those of you that don't know, when you ingest a medication, there's something called the first pass, okay? And that is kind of like your digestion of it. It goes through the liver and all of that. They are now creating these tablets that bypass that, okay? And for niche uses, buccal tablets and nasal gels offer alternative routes for those who can't tolerate standard formulations. So beyond male hypogonadism, testosterone finds roles in jumpstarting puberty in boys, aiding muscle preservation in chronic illnesses like HIV, and part of gender-affirming care for transgender men. Now, tiny doses have helped select postmenopausal women with severe loss of libido under specialist supervision. However, no reputable guidelines endorses testosterone as a panacea for normal aging, a point that the FDA has emphasized by restricting labels to medical deficiencies. Benefits when you need it. So this is like the real gains. So for those stepping off low T cliff, TRT can feel really impactful. Yeah. So clinical trials, most notably the testosterone trials, have chronicled tangible improvements across multiple domains. Sexual health often tops the benefit list. Study participants report rekindled libido, more robust nocturnal and morning erections, and greater climb when men who once trudged through the days and are now finding that motivation renewed, and mild reduction in depressive symptoms and improved vitality scores.
I mean, that's life-changing.
It is life-changing.
Yeah.
I have why is it so like taboo to talk about it? Yeah. Sex is sex. It's part of life. Yeah. And when that is taken away from someone, it can actually be impactful.
Exactly. Psychologically, it'll do things to you.
Exactly.
And then also the energy aspect of it too. If you get that renewed energy back.
Yeah.
That will change your whole day.
Exactly. But still, like, I can't imagine like all these, it's very like, I don't want to talk about it.
Oh yeah. Because we got the US.
It's society.
Exactly. It's society. Because you go to Europe or France or whatever.
Yeah,
exactly. Not a problem.
It's not a problem. Exactly. So physical metrics shift too, right? So lean body mass increases as protein synthesis accelerates, while fat mass, particularly around the abdomen, declines, okay? So 1 year of therapy can boost bone mineral density by 5 to 10% in the lumbar spine and hips, a critical buffer against osteoporosis-related fractures. And for men suffering unexplained mild anemia, elevated hemoglobin and hematocrit bring blood counts back into a healthy range, alleviating the fatigue and breathlessness. However, these benefits aren't infinite. Once testosterone saturates its therapeutic window, rising doses will yield diminishing returns and heightened risks. That's the highlight that I want to highlight.
And we're going to get to them.
Yeah.
Because there's plenty of them. So these all sound great, but you got to see the other side of the coin.
Exactly. That window corresponds to the mid to normal range for healthy young men and a target clinician's aim for when adjusting the doses. So getting there can transform lives. Overshooting the mark leads us to the next more complicated, dangerous territory. Risk of therapy. This is like when you're walking the fine line. This is when you're overshooting things. Even when prescribed wisely, testosterone wields a double-edged sword. One of its most monitored side effects is polycythemia, the overproduction of red blood cells that thicken bloods like a slow-moving sludge. To keep things in check, doctors routinely check hematocrit levels and may recommend therapeutic phlebotomy if numbers are climbing too high. Now, cardiovascular effects. That's a big debate now. Early observational studies hinted at increased heart attacks, but the Traverse trial dispelled much of that fear, showing no rise in major adverse cardiac events among men treated with testosterone compared to placebo. Still, a subtle uptick in atrial fibrillation and modest blood pressure elevation emerged, prompting the FDA's 2025 label to update and to add the specific blood pressure warning while removing the blanket cardiovascular black box. Now, prostate health requires vigilance. While normalizing testosterone doesn't create new cancers, existing malignant cells can exploit hormonal milieu for faster growth. As a result, baseline periodic prostate specific antigens, PSA, periodic PSA testing, and digital rectal exams remain standard for men over 40 with risk factors.
With risk factors, yeah. So, I mean, you don't want to get that.
Yeah.
Be careful.
The digital rectal exam. Yeah. She's talking about the digital rectal exam. I was for a second there, I was like, what is she doing? What is this?
Well, we're women. That's why we don't have to worry about it.
I had to do it, though, as a medical student.
Well, you had to perform it.
Yeah.
Oh, boy.
Listen, I'm sure many medical students have like a...
Oh, yeah. It's kind of like you're like...
I just hated it. I did it because it's medical, right?
Yeah, yeah.
But... All right. So, and like all the residents and stuff would make us do it. Yeah.
I think it's like a rite of passage then. I know.
Like, they don't want to do it, so they're like, well, just do the medical student. Like, have the medical student do it.
Oh, no.
But anyways, fertility is another casualty. So exogenous testosterone suppresses gonadotropins, halting sperm production and shrinking the testes. So young men desiring future children should discuss sperm banking before getting on a TRT, okay? So other adverse effects include acne flare-ups, accelerated male pattern baldness, and potential worsening of obstructive sleep apnea, which is not something that a lot of people talk about. So in short, the benefits are real, but they arrive packaged with responsibilities and monitoring obligations.
And that's the thing, like a lot of people don't
And
talk
not
about.
abusing.
Exactly. A lot of people don't talk about these are hormones that you're injecting yourself with, right? So if you don't know if you are propense to like have a cancer or something like that. And this is adding fuel to that fire that you don't even know you may or may not have.
Yep.
It'll just spark it. But that's scary. And I've seen it. I've seen it happen now with T, but with like other hormone therapies of like, they just didn't know that they were propense to that type of cancer. And then with that therapy, unfortunately, it like lit that fire.
Yeah.
So you got to be careful. You can't just like abuse it just because it's like, oh, it's great. It's going to do it. You got to be careful.
You have to be responsible.
Yeah.
And Julie's is now going to talk about abuse and misuse.
Just what I was talking about. Anyway, so abuse and misuse when gains go rogue. Okay. Especially, I feel like it's a big thing here in Miami.
Yeah.
You know, because of course it's Miami, the beach, all that. Like bodybuilding in the 80s and 90s was a huge thing.
Huge thing.
Being just like physically, you know, I don't even know the word of it, but like just people are very, very into the way that they look here, you know? So I feel like almost everybody that like they've been on T or they're getting on T or something like that. So you gotta be careful because then that's where you go to these clinics and then they'll just prescribe it to you.
Yeah.
You know, without any worry. But anyway, so beyond the clinic walls lies a gray market where testosterone is wielded not as medicine, but as a performance enhancer. So we're talking about like athletes from high school wrestlers to Olympic aspirants, you know, these people that they probably do have talent, but they are just so into it that they're like, you know, let's just add some more fuel to that fire. Have pumped supraphysiologic doses, okay, to build muscle and shred fat faster than nature intended. Recreational body users and gym goers seeking the chiseled vascular look often follow the blast and cruise cycles, stacking testosterone with synthetic analogs like
Nandrolone or stenozolol.
what she said. And a growing cohort of midlife men sold on the myth of an unequivocal fountain of youth. Okay, so tap telemedicine portals for quick prescriptions, sometimes bypassing proper endocrinological evaluation, which you see a lot of. That's like a whole new trending thing.
What that means is that you're bypassing going to see a doctor
And getting like tested, like your actual levels, seeing where they are. And stuff
super
like that.
physiologic, what Julie just said before, people doing super physiological levels. Physiologic means like the normal amount of your body. And you're going above that normal amount. So you're abusing it.
Exactly. So this misuse is powered by a lucrative black market. It's unregulated, overseas labs, shady gym dealers, and opportunistic healthcare providers eager for profit. Surveys show that as many as 5% of serious lifters have tried anabolic steroids, and U.S. testosterone prescriptions rose nearly 27% from 2018 to 2022, with the steepest increases among men under 45, many without legitimate medical indications.
They just want to enhance their performance.
Exactly. Because under the age of 45, it's due to something. But then yet we're seeing this steep increase. Anyway, so side effects of this abuse. There are hidden costs to this, right? So high dose abuse magnifies all the risks of legitimate therapy and introduces even new dangers. Cardiologists now warn of accelerated atherosclerosis. I can never say that.
Atherosclerosis.
There you go. Hypertension and heart attacks in men in their 30s, okay? Otherwise, healthy lifters who coronaries bear scars of steroid use.
Yeah.
That's sad. In their 30s, you're young.
But if you're abusing it for that long, you're going to
bound to
have
happen.
cardiovascular effects.
Yep.
And it's really sad because you can do weightlifting, you can do exercise, which has shown to be really good for your body.
But when you go over the top and abusing hormones and all these things to get like a
certain look
in something, yeah, then now you are abusing it at the cost of your health.
Yeah, exactly. Pathologists find enlarged hearts, dilated cardiomyopathy, and vascular thickening in autopsies of young athletes. Even liver toxicity comes into play with this, okay? With cases of hepatic illnesses and hepatic tumors documented even. So fertility often becomes collateral damage. Some athletes cycle so long that spontaneous sperm recovery never fully returns. That is horrible.
Yeah.
Leaving them dependent on assistive reproductive technologies. Psychiatric manifestations, because again, the brain is connected to your whole body, right? From heightened aggression and irritability to profound depression and withdrawal, can fracture relationships and prompt self-harm ideation. Dermatologists treat cystic acne and folliculitis, while plastic surgeons remove gynecomastia lumps caused by excess estrogen via aromatization. What is that?
Yeah, so gynecomastia is enlarged breast tissue. So it can happen in men, and that's one of the side effects of testosterone.
Yeah.
And it's not cute, right?
No.
Like they're trying to have this certain look, and then they have what they call man boobs. okay?
Exactly.
So plastic surgeons will go ahead and remove that gynecomastia, but you're still doing you never eliminated the root cause of it.
Exactly. And let's not forget the infectious risks of unsterile injection practices, bacterial abscesses, and bloodborne pathogens like hepatitis that are actual possibilities if you're abusing tea in like an injectable form.
Yeah.
So in essence, steroid abuse is a high stakes gamble where the house pretty much always wins.
Yeah.
Oh, this is history. Okay. Yeah. So here's the history of it. Well, it's a little later. We wanted to introduce you like really what is testosterone and why we're talking about it, right? So it all starts in 1849, so a while ago, right? When Arnold,
Not Schwarzenegger.
Yeah, not Schwarzenegger. It's funny though, right?
I know.
Berthold performed rooster castrations and testy transplantation experiments, revealing the internal secretion role of testes. Move ahead 40 years to 1889, and Dr. Charles Edward Brown-Sequard. Sure, I tried.
You actually did really good.
I think so. You see,
Yeah.
I could kind of do that, but whatever. Anyway, so was injecting himself with pulverized animal testicular extracts, claiming miraculous vitality boosts. The dawn of organotherapy and placebo's power, pretty much. In 1939, Ernst Lacour isolated crystalline testosterone, while Adolf Budendant, what she said, and Leopold Ruzicka
Yes.
independently synthesized it.
I'm sorry we're butchering those
We're
names.
trying,
Yeah.
guys, we're trying. So feats that earned the 1939 Nobel Prize in Chemistry. So fast forward to 1950s, John Ziegler co-developed Dynamo. Yeah, great. Okay, perfect. For U.S. weightlifters, marketing the birth of the anabolic steroid era. And the IOC stepped in by banning steroids in 1975 and testing athletes at the 1976 Montreal Olympics. The U.S. Anabolic Steroid Control Act of 1990 classified testosterone as a Schedule III drug, and WADA's creation in 1999's harmonized global anti-doping efforts. So that's where all of this came in, right?
Yeah.
And it's just to keep it equal, right? In the 2000s, low T ads launched the next chapter, reshaping public perceptions and sparking both growth and controversy in testosterone use.
All right, so now we're going to talk a little bit about like myth busters.
Because it's
right?
riddled.
'Cause everyone has a lot of questions. Well, does it do this? Is this true? Is this not?
I heard from whatever that it does this.
Exactly. Let's try to bust those.
Yeah.
All right, so the first one is that TRT, testosterone replacement therapy, is inevitably causes prostate cancer. Now, the reality is there's no evidence to support new cancer risk. However, existing tumors can grow faster. Screening is essential, meaning that if you are planning to do testosterone replacement therapy, you should be screened for certain things to make sure that everything is okay and that you are cleared to start that replacement therapy.
Don't get it from your gym buddy.
Yeah. Or don't get it from a place that is not doing these tests, that are just like, yeah, let's do it. Okay, here's a prescription.
Which
be
unfortunately there's a
thinking.
lot of them.
Yes,
A
yes,
lot
absolutely.
of these men health like clinics
Yes.
and all that stuff.
Yes, exactly. Another myth. Higher than normal T yields unlimited muscle. Kind of like what we talked about before. The reality is that the gains will plateau at a physiological levels. Beyond that, you're going to have some harm.
Yeah.
You're going to have some risks. There's no more benefit.
You're human.
Yes, exactly. Again, once you do the supra physiological level, that's when you're starting to kind of walk the line of danger. The other myth, the over-the-counter boosters work like prescription testosterone. The reality is that clinical trials show most have negligible hormonal impact. Another myth, only men need testosterone. That's another thing. Check out our, what episode was that?
was it?
Was it PCOS? Yes. Well, we have an episode where we talk about women requiring that testosterone is important with women. Women rely on it too for bone density, muscle, mood, and libido. Okay. And now
It's just in lower dosages,
exactly.
but we still need it.
Yeah. Another myth is that testosterone replacement therapy fixes all signs of aging. That is not true. It just treats the endocrine deficiency. Not every wrinkle or energy slump is because you have a T deficiency.
Right.
Now, let's talk a little bit about the latest research and headlines. Recent highlights underscore how rapidly our understanding evolves. The Traverse trial, which was published in the New England Journal of Medicine in 2023, affirmed no spike in heart attacks or strokes among high-risk men on TRT.
Asterisk there on high-risk men.
Yeah,
though.
high risk, exactly.
Okay,
So
so
you're saying high-risk men.
particularly on those men,
Yes.
not the general population of men.
Yes. So the FDA's 2025 label overhaul removed the cardiovascular black box warning and
Which I think
added
is a mistake.
Yes, of course it's a mistake. And added a mandatory blood pressure warning and reiterated that TRT is reserved for clinical hypogonadism. Basically, like a clinical reason why you don't have testosterone.
Yeah, but you should still get tested.
Of course, but you will know that, right? If you get tested, you're going to know if you have hypogonadism or not, and you're going to have other symptoms. Meanwhile, telehealth providers exploded during the pandemic, prompting KFF Health News investigations into lax prescribing practices. The U.S. prescribing rates climbed nearly 30%, okay, in 4 years, driven largely by men under 45. It's basically a trend regulators are now monitoring. COVID changed a lot for everyone. I mean, what can I tell you?
COVID changed everything.
Everything, even healthcare.
Yeah.
You also have natural boosters. Fortunately, you don't need syringes to optimize your testosterone. You have weight management tops the list. Losing visceral fat reduces aromatase activity that converts testosterone to estrogen.
So your belly fat.
Yes. Now, resistance training, which I'm always like, do it.
Yeah.
Especially heavy compound movements, acutely spikes testosterone and over the months nudges baseline levels upwards.
Which is like ironic because a lot of like men at least, like bodybuilders or whatever, they take
they
it to
do.
like increase their body mass and whatever, and yet just doing weights will increase your testosterone.
Yes. And also, I feel like a lot of bodybuilders will focus on not only the bodybuilding physique. Maybe not. I'm not into that world, so I can't really comment
But it's
on
more
it.
like the volume.
But I was going to say, like, do they do compound movements? You know, like, those are...
Like, what do you mean compound movements?
So compound movements is like, you're not just doing like a bicep curl, right?
Oh, right,
You're
right.
compounding a movement with something else. So
No.
you're squatting and doing
At least in the traditional sense, maybe it's changed now, but
don't know.
like at least that I remember in the traditional sense with my dad, it was just not. It was not compound movement. It was very like what, but maybe it's changed.
I'm
now.
not
I
into.
mean, that's,
I'm not
like,
in that
super-
world, so I
Back
can't
then.
talk
Yeah.
about it. You know, but again, it's. I think, yeah, I don't know.
Yeah.
Can't comment on it.
Yeah.
But anyways, so resistance training, especially heavy compound movements, acutely spikes testosterone over the months and nudges the baseline levels upwards. So adequate sleep, 7 to 8 hours. I think that's one of the biggest things that we don't get enough of. Prevents a 10 to 15% drop in testosterone seen with chronic deprivation of sleep. Stress control, yes. So though mindfulness, light exercise, or hobbies mitigates cortisol's inhibitory effects, nutrition matters too.
balanced protein, a healthy fat supply building blocks, while zinc and vitamin D support the endocrine engine. Finally, moderate alcohol intake avoids Leydig cell dormancy, so that high volume drinking induces that loss of T.
All right. So, cutting edge and future directions for TRT, testosterone, all that stuff. On the horizon are male contraceptive combining testosterone with progestins to reversibly suppress sperm. How do you feel about this? Male contraception.
I love it.
I agree. And like most women do. But
I
of
agree.
course, it's like, it's such a taboo topic.
Why? I don't
Because
understand that.
they're like, oh, you're suppressing sperm. You're like releasing this, you're stopping this. And we're doing the same but with our eggs.
Yeah, exactly. Or at least like controlling our hormones in that whole entire cycle. Because really, if you really think about it, you have an egg. We have an egg. We still have a menstrual cycle. You are just changing the environment depending on what kind of contraception you're on.
Yeah.
But you're changing the environment so that your body does not have a healthy environment for a pregnancy. So you lose it. You lose that ability to do that. I just don't understand why it's so like hard hit.
I don't know. It causes
for
so much.
men to be. If anything, I feel like they would want it.
Right? That's what I thought.
They're all. I mean, I shouldn't generalize, okay? But there are a lot of men out there, okay, that are always, well, the woman is not taking care of themselves, and all these things. It's like, well, now you have the chance
you have the power
to hold the power, right? But you don't want it. But you don't want it because it hits you, and you're like, well, no,
I don't
like. Every time a guy tells me that they have a vasectomy, I'm like,
power to
you, man.
Exactly. I don't understand like the whole.
I love it. I'm like, wow, look at you. Look at you, a person that you can care through, like, because
it does
care
nothing
less about what society thinks about it. You're solving a problem.
Exactly. But for us, it's a whole ass surgery for us to become like, to sterilize ourselves or whatever.
What's the other option? Be on birth control.
Exactly, which does a slew of
slew of other things.
Yeah. It's just, I don't know. Anyway, gut microbiome research hints microbial profiles that influence T metabolism and induced pluripotent stem cells from long-lived individuals promise insights into hormonal longevity. So there are trials that explore how clearing these cells might complement youthful hormone patterns. And there's even possible wearable biosensors in the tattoos, check out our tattoo episode, that may someday monitor hormones continuously. So closing that loop between data and personalized therapy. So just to close this up, if you suspect that you have low T, pursue an evaluation, okay? So at least...
by a physician.
Yes.
Not by a clinic that prescribes it, because I promise that's a business.
Yeah.
That is a business. They're going to tell you have low T.
Yeah.
Even if your levels come back normal, they're going to be like, well, we treat the patient. Which I do. I totally believe it. Like, I treat the patient, not the number. But go to a professional.
Exactly.
And get their opinion. Or maybe if you go to one of these clinics, okay, follow up with an endocrinologist. Like, should you really be doing this or not?
Yeah. There's a lot of things that could become dangerous about it to not pursue it in the right way.
Yeah.
So how you do this is that you pursue through evaluation of at least 2 morning blood draws separated by symptoms. Avoid the lure of the quick fix telehealth, because there's many, many, many of them out there, and they'll just give you the script without even proper labs. Please avoid that. If prescribed TRT, commit to follow-ups. Go into those follow-ups. Get those CBCs and PSA and blood pressures checked and all of those labs and tests done when you need to get them done. And embrace the lifestyle pillars, the diets, the exercise, the better sleep, the better stress management, all of that. You need to commit to it. Before turning just into hormone therapy and just like putting in all your efforts into that, try to better your lifestyle first, because that's going to, at the end of it, be the biggest factor into it. And then remember that testosterone is a precision tool. If it's used right, it can rebuild, but if it's misused, it can really, really, really be a bad problem. Yeah. Well, that's pretty much it.
And that was our episode on testosterone and uses and abuses.
Yeah. So just because it's the summer and you want to look good, be careful.
Yes.
And this is coming from Miamians that are riddled riddled with these type of clinics and like quick fix places and whatnot.
For women and men.
Exactly. They're everywhere. So just be your own advocate.
Yes.
Double check everything and don't just be like, listen to all the good things, because like I said, there is another side to that coin. So pay attention to it. All right. Yeah. Anyway, thanks for tuning in. Yes. Check us out on all forms of social media. We're pretty much on all forms of social media. That's Funny Medicine Podcast. If you're not into the social media world, totally get that. Go email us if you want. Yeah. funnymedicine305@gmail.com. And we'll see you on the next one.
Bye.
Bye.